Hi, I'm Dr. Joe Niamtu, LoveThatFace.com, and as I look at this globe, I see the United States and all of the different states that we've treated patients, and then as I look around the world, I see many countries for which we have treated patients, and I'm really honored to have an international practice. And it's interesting, over the last 30 years, I've seen my practice grow from around town to around Virginia, to around the United States, and around the world. With the power of the internet and social media and all of the other digital devices that we have, the world really has shrunk into a much smaller sphere. So I want to talk a little bit about out-of-town patients. First of all, there's no doubt it's always easiest for the surgeon and the patient if they live next door to the office, because the communication's easy, the transportation's easy. If you have any problem or complication, you're right there. And the further you get away from that, the more communication that you have to have. And for offices like ours that see a lot of national and international patients, a great amount of effort has gone into thinking about all these little things. So communication is definitely the most important thing. And for a patient and a doctor, the biggest thing is, for the patient, is, do you have the right doctor? What do you look for? Well, you want to look for somebody that is good and can prove it to you. They can show you before and after pictures, they have good reviews, and they have a lot of experience in what they do. So that's pretty obvious. For a doctor, what do we want? Well, we want a good patient. And what does that mean? Well, that means we want patients that are doing the right thing at the right time, and they have a sanity about them for cosmetic surgery. Many of you know about body dysmorphic disorder, and that's where people are obsessed with their looks or obsessed with some procedure, and it's an inappropriate person that wants an inappropriate procedure. And that is not a good situation for a doctor, and it's not good for the patients. So what are our best patients? Our best patients are somebody that really, they want to look as good as they can for their age. They might want to look better, they might want an enhancement, but they're not trying to be somebody else. They're not trying to change their life. They just want to look better and feel better, and that, for us, is a perfect patient. So let's talk a little bit about the communication. We get many emails a day from all over the world, either in email form or from my website about the Ask Dr. Joe, which incidentally, LoveThatFace.com, and there's a section, Ask Dr. Joe. And people send pictures and they say, am I a candidate for a facelift or a brow lift or laser or this or that? And the first thing we want to do is look at pictures and kind of have an open discussion with the patient about appropriateness of different procedures for what they have and for their age. And so this is pretty easy. And we look at pictures. You know, the next step, sometimes we FaceTime, sometimes we Skype. There is absolutely no substitute for a face-to-face evaluation. It's impossible. And, you know, it's from a doctor's standpoint, I mean, you can look at pictures, you can do all this stuff, you can talk to somebody, but until you get there and put your hands on them and feel them, just by doing that, it just, you know, a surgeon's like a sponge. All this information just comes into them, and it helps them so much. So what we usually do is start communication, and we need to find out if we're the appropriate doctor and we have the appropriate patient, and if they're going to come here. Obviously, they're coming to a strange place, so we have to, and we have this all in place, but we have preferred hotels that are close to our office. We have transportation, we have caregivers, we have a lot of different things in place to make this an easy experience, because when you're traveling, whether it's going on a vacation or working or traveling for surgery, and especially for surgery, because you're going to have recovery and somebody has to think out all of this. So you'll see that doctors that are set up for this, it's kind of a natural thing, and they can plug a patient right into the system, and again, transportation, caregivers, places to stay, follow-up. So what we usually do, if we can get enough information to decide if the patient's appropriate to come here to Richmond, Virginia. We'll set them up so we have a pretty good idea of what we're going to do. And again, the logistics, the finances, medical history, we can do so much of this over the internet and via phone or email. So we have the patient come here, depending on what surgery they may be considering, anywhere from several days to the day before their surgery. And then we'll do the hands-on preoperative consultation. I'll get to talk to the patient, meet the patient, they'll get to meet me. I'll get to touch them and take pictures and examine them and examine their medical history. And that is a huge appointment. Now, if somebody lives right down the street, we would probably do this, we'd see them as an evaluation, then we would do this several weeks before their surgery, and that gives us time to interact. If they have a low blood count, or if they have, whatever little medical condition that we might have to adjust for anesthesia. So there's communication is extremely important, and by the time the patient comes for the evaluation, we have already collected a lot of information. And that's so important. It's never happened, but I don't ever want a patient to come here and then we find out that their condition or their situation is inappropriate and we can't do a surgical procedure. And again, that's never happened because we have a high level of communication. So after the patient comes here and we can do our hands-on evaluation and interview and medical history, then we would schedule their surgery, which would actually already be scheduled by that point, and we would have in place their transportation, their caregiver, and our staff functions. We would perform their surgery. They would go back to a local hotel or at one of the residences of our caregivers. We would see them in the office usually the next morning for sure. And the question always comes up, how long do I have to stay? And of course, everybody wants to have the smallest recovery, but if you're going to come all this way, it's imperative that you're here long enough for my staff and I to do our job. And for instance, if you're having laser resurfacing, you're not going to be flying in an airport a week after your laser. Because your face is going to be raw. So that may be a 10-day stay here. A facelift with numerous other procedures like brow lift, eyelids, cheek, chin implants, whatever. Those patients may stay here a week to 10 days. Some patients can come and go. We have some patients that only need to stay overnight for smaller procedures, and some patients need to stay a couple days. But the worst disservice that I can do is to let somebody leave without the proper follow-up. So if you're going to do this procedure, and you may only do it once in your life, and you're traveling a long way, you have to stay here long enough, and we'll go over all that with our patients beforehand. So I'm really honored to be in the position to have an international practice, and I'm really a lucky guy because what I do for a living is my job, but it's also my passion, and I just enjoy just talking about cosmetic facial surgery. So we invite you to look at our website, lovethatface.com, and my staff and I are here to interact with you. And again, it's a small world, and it's getting smaller, and it's my honor to be a part of it. For lovethatface.com, I'm Dr. Joe Niamtu.